Doctors of Reddit, what was the wildest self-diagnosis a patient was actually right about? I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising really easily and had petechiae. I wanted to go to urgent care where I knew the CBC was done quickly on site, but he instead wanted to wait to go to his primary. I took him to his primary and had a bag packed for the hospital in the trunk. The doctor told him it was likely a B12 deficiency but that he'd do blood work to put my mind at ease anyway. I asked if the CBC was done on site or not, and he said it was sent out. I asked if he planned to rush the CBC. He got very angry and said, "There is nothing the CBC could show that would change my treatment plan." Then he told my partner he needed to stop me from Googling. We got a call that night from the lab that his WBCs were dangerously high and platelets were dangerously low, and I had to immediately take him to the ER. I did, and he was diagnosed with acute leukemia. I work at a cancer center. Our docs always say that if your doctor discourages you from getting a second opinion, you need to find a new doctor. Your partner was very lucky that you knew what was going on and that he got to the ER in time. One of my dearest friends from middle school was suffering from absolutely devastating medical issues. She went from bright and thriving in university to having to drop out before she graduated because her health bottomed out. She lost her job that paid her a fantastic amount. Basically, her entire life fell apart. She was telling me about the new weird thing happening with her, some strange anemia that was found to be the result of abnormally low ferritin in her blood, which is what enables your red blood cells to carry iron. That was when something clicked in my brain: horrible digestive issues, peculiar anemia, chronic infections in her spleen that required a splenectomy, would sunburn to a blistering point in less than a half hour, a diagnosed allergy to sulfa drugs, horrible reactions to carbamazepine, retinol gave her a suppurating skin rash. I'm a pre-med dropout, and one of the first classes I took on my path to pre-med was an undergrad course in rare conditions and diseases. And one of the ones we discussed in our inherited disorders segment of class was porphyria. There's an easy way to tell if someone has porphyria. Have them pee into a clear plastic or glass cup and expose it to direct sunlight. In a period of hours to days, the urine of people with porphyria will turn from clear or yellow to a wine red or wine purple. So I asked her if she trusted me enough to do something weird, told her to get a clear plastic disposable cup from her kitchen, pee in it, and put it in her windowsill where nobody could see it. And if anything about it changed, come tell me. Approximately 4 hours later, she called me on the phone screaming that her piss turned fucking purple red like a goddamn vampire, and I told her she needed to go to the doctor and get tested for porphyria. 2 weeks later she tagged me on Facebook calling me Lesbian Dr. House because she was diagnosed with congenital erythropoietic porphyria. Edit, for everyone saying I stole this from Scrubs. I didn't even know Scrubs had a porphyria episode, so I looked it up, and it came out a full year after this happened. Also, watching Scrubs and giving someone a DX doesn't cost you $100,000 that you end up having to pay back for 20 years. ICU doc here with over 10 years of experience. While it's not quite a diagnosis, experience has taught me to take very seriously when a patient states he's about to die, even if he appears in a stable controlled condition. Patients who have a life-threatening condition usually have a premonition about their imminent decompensation, which is usually preceded by very subtle signs of worsening that may be confounded with pretty much anything that happens on a resuscitation room or on the back of an ambulance. I've had patients who appeared to be in a completely stable condition, with acute conditions where cardiac arrest was not foreseeable. Example: motorcycle accident with single limb injury, who briefly mentioned they think they are about to die before suddenly entering in cardiac arrest due to a malignant arrhythmia. It's believed that patients may perceive a sudden drop of blood pressure and/or the usual release and spike of adrenaline and other catecholamines as imminent death, but the reason why this happens is not clear. Some we are able to return, others we lose or recover them to a state where death would be better. I've experienced this, it's super creepy. 6 years ago I had a missed miscarriage. There was no more heartbeat, but my body wasn't doing anything about it. I felt dread. I tried to tell myself I was just anxious about the baby and I'd feel better after the next ultrasound. But this wasn't my first pregnancy, and I hadn't felt like this the first time. The feeling slowly built up over a week. and then I had just the tiniest bit of bleeding, and immediately took myself to the ER and was like, "Yo, I'm miscarrying. Help me." The feeling was so strong, all it took was the slightest confirmation for me to act on it. The ultrasound confirmed fetal development had stopped a week ago, but an ultrasound tech can't give you that information themselves. The doctor has to do it. And the doctor didn't bother to look at the report, and just did a pelvic exam. He was like, "That's barely any blood, you're good," and sent me home. I still felt like death itself was reading Reddit over my shoulder. But the doctor said my baby was fine and I wanted to believe him. I even asked him what the fetal heart rate was, and he lied to me and told me there was one. So I went home. I was back 12 hours later because blood was just flowing out of me. When I sat on the toilet it sounded like rain. The pain woke me up, and my bed looked like I'd been shot in my sleep. When I woke up from surgery the feeling was just gone. I did file a complaint, it went nowhere. Had a patient who came into the ED with vague mild abdominal pain whose friend recently died of colon cancer. She was convinced she must have it too. Told her cancer wasn't contagious like that, but ordered a CT scan because she was so insistent in order to reassure her. Lo and behold, she had a huge colon mass. Very bizarre case. Woman in her 40s came in and told me she was having seizures. I asked how she knew and she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms more associated with classic seizures, but I ordered tests anyway. Turns out she had been having multiple focal seizures. Not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he was sitting on the couch or recliner. He would walk up, sniff, and keep sniffing until my uncle would shoo him away. A bit later he would come back, sniff again, and just stare at my uncle. A few weeks later my aunt was watching one of the local news channels, and they featured a dog that could smell Parkinson's, and she jokingly told my uncle about it. He mentioned their dog constantly sniffing one spot, and one spot only on his back, so he went to a high school friend who was a doctor in dermatology. He said it didn't look right and did a biopsy on it. Sure enough, he had skin cancer, but they caught it early and all he ended up with was a scar on his back. My niece was trying to get pregnant for a long time, and it just wasn't working. At one point her dog got very clingy. Just wouldn't leave her alone for a minute. Complained about it to a friend. Friend said the only time her dog was that way was when she was pregnant. My niece said, "Holy shit." Checked it out with a pea stick, and doggy noses don't lie. Patient here. Told my family GP, who I'd seen since I was a kid, and who worked with and saw both my parents as patients for years, that I thought I had reactive hypoglycemia. He scoffed. "You don't have that. Why would you think you have that?" I told him my symptoms. He was doubtful, but told the nurse to get me a Coke and made me chug it. Sent me to roam around the hospital for a little bit, then get blood work and come back. I came back, and his first words were, "This is so aggravating. Does that mean I have it?" "Yes, that means you have it." I'm a nurse, but just had a patient who came in for a colonoscopy due to constipation and pain with bowel movements. He told me prior to the test he felt like there was something catching on the left side of his abdomen when he pooped, and was like, "Maybe I have a big polyp there or something." Sure enough, he ended up having a 2.5 centimeters polyp that we removed from that exact area. I'll never get to find out if that catching sensation ever went away for him, but I thought it was interesting that he was right. I totally get how he could feel that. I accidentally swallowed a fishbone, and it lodged in one of the bends of my colon. I could feel it move every time something passed by. It was stuck there for a few days, just poking like a cactus needle, until I ate a mountain of celery, and that entangled it and moved it along. Had a patient come into the ED, and told me he had epiglottitis, an uncommon infection of the epiglottis, part of your throat, when I went to see him. I asked how he knew he'd had it before but was also a 90-year-old retired ED doctor. He was right. I'm not a doctor, but this is what happened when my son self-diagnosed correctly. 3 years ago he developed a terrible earache and went to urgent care, where they told him he had an ear infection and gave him an antibiotic. The pain intensified over the next day or so he returned and was told he should make an appointment with an ENT. But because it was the weekend, no ENT offices were open, so he had to wait until Monday. In the meantime, his ears started draining and he saw what looked like spores in the fluid, which would indicate a fungal infection. He's a naturalist and knows what spores look like. The pain grew so intense that he ended up going to the ER. He told the doctor who examined him that he had seen spores in the drainage from his ear and suspected that he had a fungal infection. He later heard the doctor talking to a nurse in the hallway, laughing and saying, "He thinks he saw spores." The doctor prescribed another antibiotic and a steroid. The next day, he flew home to see us for Thanksgiving. I don't know how he managed the flight, because as soon as he got here, he curled up on the floor, howling in pain. I immediately called ENT offices all over town, but most were closed for Thanksgiving week or said they could not see him. Finally, one scheduler took pity on him and said she would move things around to get him in. A PA examined him and confirmed that it was a fungal infection. She told him that the steroid he had been prescribed by the ER doctor was the same agent used in the laboratory to culture fungal infections. His infection had started to enter the eardrum and from there could have spread to his brain and killed him. She gave him a prescription that cleared up the infection very quickly. The wrong diagnoses at urgent care and the ER cost him over $1,500 out of pocket and several days of excruciating pain. The ENT's office did not take his insurance but charged him only $250 for the correct diagnosis. Not a doctor, but in junior high I had a little cough that just wouldn't go away. My grandmother was convinced it was whooping cough. I felt totally fine, it was just an annoying cough. She made me go to the doctor and told the doctor that she thought I had whooping cough. The doctor informed her that it hadn't been in our area in over 10 years, so she doubted that was the case. My grandma forced her to test me for it anyway. Turned out I was positive and considered patient 0. The whole school basically ended up getting it, and we had to shut down for 2 weeks until it went away. I work as a medical lab tech. We had a patient who came in insisting that her neighbor was poisoning her. Everyone dismissed her assuming she has some kind of paranoid psychosis. She remained in the ER on a psych eval. I ran all the standard labs on her, and they were normal, but this patient would not budge. She was admitted to psych on a hold. At this point, one of the hospitalists decided why not, and ordered labs to test for several heavy metals and ethylene glycol. Her ethylene glycol level was 32. I don't know if she was legit being poisoned by her neighbor or if it was self-induced, but damn, that patient taught me a very important lesson that day. The lesson that if a patient tells you they're being poisoned, you should probably check for poison? Nah, throw them into the loony bin, since they are obviously delusional. I'm a patient. I had a super painful skin infection on my face and neck that my dermatologist insisted was just an eczema flare-up. She prescribed topical steroids. They help in the short term, but I continued having painful rashes on my face. Edit. I asked if it could be a fungal rash, but the derm said she was sure it was eczema. Unfortunately, steroids weaken your immune system, thin your skin, and facilitate spreading of any infection. A few months later, my hands and fingernails get really painful. Life was hard because I was in pain when I tried to do normal things like write, type, open things, etc. Eventually, I started getting bleeding blisters on my hands and my actual nails turned yellow. I see the dermatologist because at this point I realized topical antifungals give me some relief, but I'd need oral antifungals to treat the actual nails. The dermatologist swore this was eczema dyshidrosis. I asked for a culture to be taken, and she took a swab, not a nail clipping, which is needed to diagnose fungal infections of the nails. So the diagnostic test of course came back negative. She prescribed steroids again, but I was hesitant to use them because at this point, I did not trust my dermatologist one bit. I see my PCP and tell him what's up. He agrees to try oral terbinafine, and it fucking worked. My nails fell out and grew back in, and the infection cleared up. The rashes on my face cleared up too. I was on the antifungal for 7 months. I had a follow-up with the dermatologist, and showed her how the antifungals actually worked and to show her she was wrong. How'd she react? I didn't get to see her first reaction because the medical assistant, MA, told her. I was maybe 2 months into the oral antifungal at this point, and my skin and nails were still visibly healing. The MA was there in my previous appointments too, so she had seen me before. My skin looked better, and she assumed it was from the steroid cream. I let her know I never did use the steroid and was put on terbinafine instead. She had this, OFUCK, look on her face. The derm came in a while later. She came in kind of nervously. My hands look better, and that my face looked clearer than she'd ever seen. She told me to keep taking the terbinafine since it seems to be helping. Then she started talking to me about wearing sunscreen and moisturizing LOL. Not a doctor, but a patient. I got mono at 16. It didn't leave. I was getting recurrences twice a year where my lymph nodes would swell and I would get sick just like the first time. My blood test showing glaring red positives for mono markers. I got my tonsils out in my 20s and the mono seemed to subside. 2 years later I got all the same symptoms. Swollen lymph nodes, fatigue, all the rest. I went to the urgent care. The PA took one look at the bumps under my arms and prescribed me antibiotic cream for ingrown hair. I told him about the mono. He rolled his eyes and told me they were infected ingrown hairs. I insisted on a blood test, even if I had to pay out of pocket. Blood test came back and not only was I positive for mono, the markers were 19 times the normal numbers for a positive case. This thread made me remember that story. Haven't thought about it in a while. Patient here. Was through hiking the Appalachian Trail and was in Southern Virginia, near Roanoke. Was having a fine day until I went to pee in my motel room, straight blood. Also had been getting weird spots and sores on my legs that didn't go above my waist or below my ankles. ER doctors, 3 of them, all stated it was a tick-borne illness, considering I had been hiking for a month in the woods. Rocky Mountain spotted fever probably. But I had that in college and knew it wasn't it. I told the 4th ER doctor who came in that based on my Googling I had Henoch-Schönlein purpura, an autoimmune disorder that is very rare in adults. She agreed, sent me to Virginia Tech for a biopsy and they confirmed vasculitis. Went on to get arthritic pain in my knees and severe abdominal pains. Went for an ultrasound and discovered I had underlying autosomal dominant polycystic kidney disease that after testing, I did not inherit from my parents. Doctors began talking to me like I should be in a textbook. 7 years later I am symptom-free and just taking a small dose of blood pressure meds but felt like I was on house for a few months there. Me, doctor, I have a kidney stone. Doctor, no blood in urine, can't see anything on ultrasound. 3 days later. Me, my stone is causing me pain and cold sweating. Doctor, let's talk about an X-ray of your spine. Doctor, there is a slight misalignment. Could be a trapped nerve. Referred to a spinal surgeon. 2 days later. Me, taking a piss, what the fuck was that? Me, doctor, here is the 4mm stone. Patient, but I ran cross country in college. My senior year my thigh aches. I told everyone something was wrong with my bone while being told it was a muscle issue. After being treated for every muscle issue in the book, I demanded an X-ray. I had a stress fracture more than halfway through my femur. Not a doctor, and I don't play one on TV but nearly became a doctor half a lifetime ago. I diagnosed my husband's brain tumor, leading to emergency surgery. A month in and out of the ER, personality change, couldn't stay awake, diagnosed with a B12 deficiency, dehydration, frequent vomiting, vision looked weird, but he could never explain it. Turns out his peripheral vision was gone, and a swollen optic nerve, probably just high BP, from ophthalmology. After a weekend where I could barely wake him up, he went back to the ER where he waited 4 hours in the waiting room. I asked him if anyone had done a CT or MRI of his brain, just throwing crap at the wall to see if anything stuck, and I assumed they had not. Told him to insist on a CT, because I had a wild sneaking suspicion. 2 hours after being called back, he was in an ambulance on his way to a different hospital with a neuro ICU to get scheduled for emergency brain surgery. Massive tumor with dangerous obstructive hydrocephalus. Patient here. Halfway though my cancer treatment, tell them it's back. No one but mom listened to me. After 2 months of non-stop telling them, they did a scan. Turns out yes, I had cancer again, and look, it was getting close to being terminal. The student doctor learned to listen that day. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.